Perfect. Good morning, everybody, or good afternoon, I should say. If you can hear me, go ahead and type yes in the chat. Just want to make sure that my audio is working fine. Perfect. We love to see it. I'll go ahead and get started then. Hello, everybody. Welcome to the third installment of our ZagTalk 101 summer webinar series. My name is Anna Sanford, and I am the current Office Coordinator for Parent and Family Relations in Office of New Student and Family Programs. I'll be hosting the Q&A portion of this webinar later on. Before we begin, I wanted to let everyone know that we do have live transcriptions available for today's webinar. There should be a CC button at the bottom of your Zoom window that you can click to enable subtitles if you would like. Today, I'm joined by Jenna Parisi, the Director of the Office of Health Promotion, and Shawn Joy, the Interim Director of the Center for Cura Personalis. We'll start with a presentation from Jenna Parisi, followed by a presentation by Shawn Joy, and then we'll move into a combined Q&A session. If you have any questions during their presentations, feel free to drop them in the chat below. Also, we ask that you remain muted the entire time that you're with us today. As always, this webinar is being recorded, so if you'd like to rewatch it later, a link to the recording will be posted in our communications portal and on our Gonzaga New Student and Family Programs YouTube page within the next couple of days. With that, I am going to turn my camera off and hand things over to Jenna to begin our first presentation of the day.
Thank you, Anna, and thank you all for being here. I'm excited to be with you and to tell you a little bit more about the Office of Health Promotion. So give me just a second here while I share my screen. And can I get a thumbs up that that is working? Thank you, Shawn. So yes, again, welcome. My name's Jenna. I'm the director of OHP, as we like to call it. This is my 7th year as a staff member at Gonzaga, and I also did my undergraduate work at Gonzaga. So it's really fun for me to be a part of this community in various ways and to share with you some of what has evolved over time. Our department is about fostering student well-being through proactive, non-judgmental, and inclusive public health principles and practices. And what that means for us is that we want to provide myriad opportunities for students to learn, reflect, and then take some action during their time with us here at Gonzaga. And we all really have a role to play in that. Our goal is really that this is a place that makes it easier for students to be well, as opposed to harder. Okay. So what I'm going to do today in the presentation is just kind of give you a general overview, introduce you to our staff, tell you a little bit about some of the priority topic areas that we focus on, and some examples of initiatives and ways that your students might interact with us over the year. And then I'm excited to see what questions that you all might have. So for those of you who can see me, again, I'm Jenna, but I do not do this work alone. So I have a team of very passionate health promotion specialists, Sydney, Bethany, and Stacia, and we work alongside an even larger team of student employees and volunteers. So we are in recruitment season right now. So if any of you have students who are interested in health and well-being and a variety of topics and subpopulations, we would love for them to apply to work with us in our office. We have general office assistants, folks who do marketing and social media, and then folks who do more of our kind of topic specific content. And one of our major goals for the next year is really to get a lot more student engagement. So when we develop programs or initiatives, we want to make sure that we're speaking to the voice of the students and kind of always have the pulse of what's going on in this environment. Because we know that students do not make decisions in a vacuum. When I say public health and using that perspective, it's in a model like this that's called the socio-ecological model. And what this means, again, is that students don't make decisions just on their own, but they are influenced by their broader ecology. So everything else that's in the environment around them. And you all are one of those examples. So when students come to us at the individual level, we know that they have certain strengths, they have certain experiences and identities that are going to influence the choices that they make, particularly in regards to their health and well-being. Moving up the chain, we know that in at the interpersonal level, these are any of the other relationships and groups that they intersect with during their entire lifetime, and then once they come to Gonzaga. So folks like you are incredibly influential. You can think all the many folks who have impacted your students so far in their lifetime, and what their hopes may be for making some of these new connections while they're at college. At the institutional level, we think about what's going on at Gonzaga as an organization that is again influencing our students. So do they have, comfortable places to be? What are the policies? What are the rules? What are the norms that also may be influencing their behavior and their decision making? Because we want students to be able to make informed choices, and we want to be able to set them up for success. So we're thinking about all of these levels, including what's going on in the community and what's going on in society. I think the past year and a half have been really illustrative for us of something like a pandemic influences and trickles our behavior all the way down. So if there's something major that's going on that's influencing our students in health and well-being, we need to be able to adapt and pivot and understand that that's going to and sometimes take a toll, and it sometimes have a really positive effect on our students. So we kind of monitor and gather data to cultivate an awareness, again, of all of these levels and the ways that we all play a role in influencing the health and well-being of our students. We commonly also talk about holistic well-being. That's part of our mission at Gonzaga. You'll hear Shawn, I'm sure, talk a lot about how his department does that individually with students, but we draw on these 8 dimensions of well-being. And so we have a lot of conversations with students about finding balance, because the expectation is not that your student is going to be at 100% with these things at all times. I'm not in my personal life, and I imagine that many of you are not as well. If you are, send me a chat message and we can have a talk about what are some of the strategies that have been so successful for you. But we want students to know that, coming to college, right, your intellectual growth is probably going to skyrocket, right? You're jumping into classes. Socially, you might be really excited. If you're coming to live in a residence hall for the first time, spiritually, you might be excited about what you're going to learn and grow. Physically, you might have access to a gym and be excited about that, or you may not have access to things that maybe you've had coming from home. So we want students to understand that, we're not just talking about one facet, but that there's also this network and web of support, so that hopefully they have opportunities again to learn, reflect, and then act in many of these areas. Now, when it comes to our sort of priority topic areas, we generally do a lot of work in these 3 because, again, we collected a lot of information, and this is both nationally what a lot of our traditional college-age students experience, especially those who are living on campus, is healthy relationships, navigating what that looks like when they're at a university, substance use. So whether or not they choose to party themselves, it's likely that they're going to encounter this at some point in their experience. So we want to be able to provide resources. And then when it comes to mental and emotional well-being, we want to talk about on sort of the positive health promotion end, what can we do that we could all benefit from, so we could all be doing a little bit better probably in this realm. And then at the far end of the spectrum, making sure that folks who are really starting to struggle get connected with the resources that they need. So these are some of our major topics, and I'll give you some specific examples of how we do this. And I'll talk a little bit more about ZAGS Help ZAGS, which is our bystander intervention program on campus. So if you've ever seen maybe a sign, in a community setting on a bus or an airport that says like, see something, say something, this is on that same line of thought that we have on campus. Now, your students are going to be required to take a course called ZAG in Action, which I am very grateful that Anna and the crew and new student family programs are managing. But I want to mention this because students are going to get a lot of information about those topics that I just mentioned from our office, in addition to a lot of campus partners. What we also know is that our families are super influential in our students' decision-making around those topics. So I said, hey, talk about it, because your influence matters so much. And I wanted to share a little bit of an example from last year and what we saw with our incoming class of 2024. So I apologize because I think this slide came out a little bit blurry, but I'll walk you through it. So basically from our incoming class before they started last fall semester, we asked them, how many of you had had a conversation with your parents or your family or caregivers about those 3 topics? And hopefully what you can notice is that the majority of folks are talking about all of these things. They're talking about alcohol and drugs, they're talking about mental health, and then a little bit less, but the most still are talking about what healthy relationships should look like. And how often are they having these conversations? The bottom slides indicate that a lot of folks are talking about these frequently. A bigger group is talking about them, at least a few times. We've sat down, we talk about these things. And then a smaller group says, well, hey, we talked about it at least once. So wherever you find yourself on this spectrum, we want you to know that you're not alone if you're talking to your students about these topics, and we really encourage you to continue those behaviors. And we work with new student family programs to try to provide you some specific guidance and talking points, maybe on some of those topics that maybe you feel a little less comfortable engaging with your student. So I mentioned Zags Help Zags, again, as our bystander intervention program, because your student is going to be a part of a community and they're going to witness things and they're going to have opportunities to step in and intervene. And that could be on the proactive end. Maybe they cultivate a group of friends and they say, hey, we're going to do these fun things together. We're going to support each other in this. We're going to have our study time. We're going to have our workout time. We're going to just sit back and relax at this time. Those are things that they can do as a group and individually on the proactive end. We also know that there's going to be times where there's going to be challenges that comes up. They're going to witness things, and we want them to be proactive about thinking about how they might respond. What can they do when situations do arise to prevent potential physical, mental, or emotional harm? So you might have a conversation with your student about what the expectations have been so far. What kinds of things did they encounter in their experience back at home, or maybe in high school, or maybe even in the virtual arena where they've had the opportunity to consider and talk about some of these behaviors. They'll get exposure to this program, particularly in the course and then throughout the orientation weekend, and hopefully ongoing throughout their experience while they're here on campus. So going back to those three topics, I'm just going to run through some quick examples again of how students might encounter these. So our office provides less of that direct support and more of thinking about where can we message students in the environment. So here's an example from a health communication campaign that we ran that used some of our data to norm for students kind of what's going on with your peers, right? We shared that overwhelmingly students say that they don't need a romantic relationship to feel happy. And that even those students who are in a committed romantic relationship make sure that they have time to themselves. So we're trying to get them to think on what are some of those healthy versus unhealthy signs in relationships. And if they want more information or support, what are some of the resources on campus that they might be able to turn to? So you see that Center for Cura Personalis was one of those that was highlighted, and our Lincoln LGBTQ+ Center was another one that was shared on this one. And then there's kind of a QR code for students to learn more. So these are the types of things that students may see in the environment, and hopefully stimulates a little thought on kind of what's going on for me, how do I compare to my peers? So a lot of you might have questions specific to alcohol and other drugs. So we are going to host a panel discussion during orientation weekend that'll touch on a lot of these kind of party aspects and what's going on at Gonzaga, because this is something that we think is really important. And that's why we talk about it rather than try to hide things under the rug. Okay. We know that a lot of students come to us with behaviors already in place, but a lot do not. However, that evolves over their period of time while they're at college. So again, your student does not make the choice to drink or do drugs. That's awesome. We want to support them in that. We know that they're making those choices for a variety of reasons and they're not alone, but they are also likely to encounter others who are making different decisions, and we want to be able to support them in how they're navigating this environment. So one of the resources that we do have through the Office of Health Promotion is called Our House. It is our collegiate recovery community, and it's non-residential, but it's a physical house that's located on the edge of campus where students who are in recovery, or students who maybe start to have a difficult time with their alcohol and drug use, maybe they decide, it's not really working for me anymore. I want to cut back. I want to talk to somebody about maybe some harm reduction strategies that I could use. This is a great asset for them. They can get access to the house to have a safe place to be with other students, to study, just to drop in. We host regular hours. There are drop-in times where they can meet one-on-one with Sydney, who's a member of my staff. Or if this is an experience that you've had in your family or in your larger community network, again, another place to kind of explore and have some dialogue. So this is always a resource that I like to highlight in that area. When it comes to mental health, again, there's a multitude of ways that we want students to engage. So if they're really starting to struggle, they can tap into some of those resources. But on the proactive end, what are some of those other things that we know make a difference in students being able to approach inevitable challenges and stressors that are going to happen while they're at college and be able to bounce back from those things? So this is an example of a slide that was from a program that we ran for faculty so that they could share information during their classroom sessions. So it might be something that's up on a board that a student would notice, we might have the opportunity to kind of be in dialogue with their faculty member or with their peers about. So again, small steps that they might be able to take that could have a positive impact on their mental and emotional well-being. There's also a number of passive health education resources that are available to students at any time. So this might come up in a conversation with the student. I invite you all to explore this if you want to know kind of the type of topics that are on there. It's called the Wellness Toolbox. It's got a direct link from Gonzaga's webpage. So students can go on there if they want to learn more for themselves or maybe somebody else. So again, whether they want to, proactively see what's out here, how can I learn more? What can I be doing a little bit better? Or if they get to a place where maybe they're concerned about a roommate or a friend, they could do a little research both into on or off campus resources or other things that might be helpful in that dialogue. So this is sort of a fun thing that we continue to refine and play with and add to have resources that are going to be relevant for our students. Also on the Wellbeing Resources webpage is a number of kind of brief screenings. So maybe you've been, to a doctor's appointment or done one of these online screenings. It's kind of ask 10 questions and it gives you a result and it says, hey, if you want to consider talking to a provider, here's what you could consider. So that's another one of those passive health education resources that's always available to a student that they can explore online. This is another example of kind of slides, posters, information that's out there in the environment for students to know that, hey, we support each other in taking steps to improve your health or well-being. So whether you're being proactive or reactive and you're seeking support, you are not alone. There's a lot of folks out here on campus. You're going to hear from Shawn and CCP, one of those specific resources next. There are a lot of crisis support options. So again, we want students to know if you happen to be, wherever you are at any hour, there are also options that are available to you. And then we have some great community partners that we work with if they need. So while the Office of Health Promotion might be providing something like a guided meditation once a month in our kind of Mindfulness Monday program, again, if they need something more intensive, they can do some of this exploration online or get connected to folks who can help them learn more. All right, so this brings me to the last slide, which is just some contact information. We are located in Crosby, which is in the center of campus. Shawn's going to speak next, and our offices are actually right next to each other here. So another reminder, invitation, if you have students who are interested in these topics, to consider whether they might want to work in our office. Other ways that they might be proactive in thinking about how they can set themselves up for success at Gonzaga, thinking about what routines have really worked well for them that they can carry over in terms of their health and well-being. If they haven't been, to campus yet, again, taking some time to kind of walk around, think about the environment, think about those spaces that are going to be helpful to help them during periods of heightened stress, and where are those spaces where they're going to be able to seek and build that sense of community and belonging that's going to be so influential in their journey. So I thank all of you for tuning in and learning a little bit more. And again, just want to emphasize how critical and how much of a role and an impact you really do have on your students in having these conversations and this ongoing connection with them. So with that, I will stop sharing my slides and turn it over to Shawn.
Thank you, Jenna. Can everyone hear me okay? Thank you, Jenna. All righty, well, let me share here. Well, good afternoon, good morning, wherever you are in your day. I'm excited to be here with you all and be here with Jenna to talk a little bit about our office. So the Center for Cura Personalis, or CCP for short. I'm Shawn Joy, I use he, him, his pronouns. I've been at Gonzaga for almost 5 years now, and I currently serve as the interim director of CCP. Previously, I received my undergraduate degree and my master's in higher education administration from the University of Missouri, and I'm from Chicago. So I'm very proudly from Chicago. So I'm excited to be here with you all today. All righty. So CCP, what is Cura Personalis? So Cura Personalis in Latin loosely translates to care for the whole person. And it is a huge part and a tenet of the Jesuit tradition and a big part of our mission here at Gonzaga. And so there are multiple components to Cura Personalis, but the main piece that's the most salient is, right, that care for the whole person, understanding that your ZAG, your student, yourself, brings so many different beautiful things to the spaces that you're in, to the world in general, to the work that you do, and really try to celebrate those things and really advocate for those things and to help accompany students along the way in terms of their whole person and what does that look like while they're in college, right? We know that college is a very different experience than high school. And so accompanying students and celebrating and helping them learn about those pieces about themselves is something that we all do. Even though it's the title of our office, it's the work. And I think, as you saw in Jenna's presentation, very much the work of many folks on campus. And our goal is for it to be a part of everyone's work at GU. So next. So what we provide, we are non-clinical providers. So we provide non-clinical, meaning we're not counselors or therapists, but case management, or we like to say resource brokering. So this idea of supporting students, accompanying them through different challenges and barriers and different pieces of, oh my gosh, I'm at college. This is so weird. I don't know what I'm doing, right? And we can meet with students one-on-one and help them, guide them through some of those pieces, ultimately working towards themselves being self-advocates, right? They know the tools and the pieces that they can use to thrive. And so we meet with students one-on-one to get them connected to the appropriate resources, whether they be on campus or off campus, whether they be something at home for the summer, right? It's the end of the academic year, it's time for break, and they need connection to a counselor at home, or they're trying to find some sort of well-being activity at home, and we work collaboratively to figure those pieces out. We do also do some training consultation, both for folks as yourself, off campus, as we like to say, and then our colleagues on campus as well. And then a big part of what we do and how we are able to interact with students is our refer form. So the refer form is our process of being able to, for community members and families and peers, fellow ZAGs, to be able to submit a form with a concern that they have about another student, and for us to then be able to reach out to that student. We'll talk a little bit more about refer forms here, but that's one of our main referral sources. We work in collaboration with academic advising and assistance, our amazing colleagues over in AAA. And so we do both the behavioral and the academic pieces, and we have a system that we both utilize together collaboratively so that we can provide our ZAGs a very holistic realm of support and making sure that they're getting connected, right, to all the right pieces. Oh, I want to skip my team. So this is my wonderful team here. So I have 3 full-time case managers. So James, Chad, and Erica. And so they meet with students one-on-one throughout the academic year and in the summer, as well as Mary, who's our office manager. She's out in the summer. We miss her. Hopefully she'll be back soon. And then we have Taylor, who's our graduate assistant, and she's currently working with me on developing a basic needs program for our ZAGs that need support getting connected to basic needs like food and clothing and housing and those types of pieces. So wonderful team. I love them all very dearly, and they have been amazing addition to, we're a very new team. So an amazing addition to Gonzaga and to our student support. So why is this work important? You know, I even think about my experience over 10 years ago, going to college and you know, thinking it's going to be this incredible, everything's going to be wonderful. I'm going to run through roses and it's going to be fabulous, which a big part of it was, right? But the reality is that, and as you all know, probably know, is that there are so many different things that we experience in our life, especially as we move on from high school and you know, we go to college and there are those pieces there in terms of learning about ourselves and learning about the world and learning, meeting new people and being in a whole different environment and what that looks like. And so the reality is that there's gonna be all these fun little, I never ran into a boat in the water, but there's gonna be all these different pieces that we have to learn to navigate. And so part of that process to help students, accompany them through these challenges, but to then also give them the tools so that at certain points they can figure out these challenges independently and be able to reach out to the people that they need to be successful. So again, what we do a bunch of things, but our main purpose is we meet with students one-on-one to provide that support. We outreach to students of concern, whether they were referred to us through the refer form or by a phone call, or maybe we talked to a family member who said, I'm worried about my ZAG. I want to get them connected. I'm not sure how to do it. I want to talk to them, but I'm not sure. And so we can help walk folks through that process as well of how to get our students connected to our office. We like to say that we're sort of, we're the hub of support on campus. And so we can meet with students and really figure out, you know, initially they could say, well, I'm sad or I'm depressed. Okay, well, let's unpack that a little bit. So then maybe there are other components to that that are being impacted, right? Like academic performance, like maybe I'm not feeling connected at Gonzaga. And then we can figure out the different resources to get our ZAGs connected to so that they can really, we are looking at that holistic person. We work really closely again with on and off campus resources to really provide a breadth of support for students and understanding that all of our students have different things and identities and pieces that they bring to Gonzaga, and we want to be able to celebrate and support those pieces. And so trying to figure out different things that work for different students and making sure that we don't just have a few things that generally work for everyone, that we're really intentionally working to find those pieces. And that's where a lot of collaboration comes in with Jenna and her team and OHP as well. And then we do a lot of, we always, if we meet with a student, we're always following up with them, whether it be another meeting, whether it be through email or a text, whether it's going to get coffee with them, just to check in how they're doing and making sure that they have what they need to be successful. And then ultimately, again, our goal is self-advocacy. I think that's a lot of our goal, a lot of us here at Gonzaga, faculty and staff, our goal is that students can really become a person who thrives in all kinds of environments and knows those people and those resources to reach out to for support. So we can help with, I mean, it's like Mary Poppins bag. We can help with anything, you name it. We're gonna try to figure it out and try to help students navigate. We generally, the things we see the most, and the things we've seen the most this past year and throughout the pandemic, right? We're seeing stress, anxiety. We're seeing a lot of relationship concerns, whether they be roommates, whether they be, I'm trying to make friends, but it's so weird because how do you meet people over Zoom? It's communication, those pieces, especially this past year. We're also seeing a lot this past year of disordered eating and supporting students with those challenging concerns as well. So we're seeing a huge breadth of pieces, students who need to receive emergency support for mental health, and we're able to help navigate and accompany them through that process and support them and being able to communicate with you all, with their families about what's going on and trying to help them advocate to you all when something is occurring, whether it be I'm just sort of sad and feeling a little lonely, or it's I'm really, I'm experiencing some pretty deep, concerning thoughts, or I'm really struggling in many facets. And so we really try to work with them too, to communicate with you all and communicate with the people that can be the most helpful for them. So we work with, also Mary Poppins Bag, we work with a ton of campus partners. So both our academic partners, so we have we have an office called the Center for Student Academic Success. So within there is our academic advising and assistance. We have our disability access office, which you'll hear from them and you'll receive some information from them, and they'll be around at orientation. But if your student needs accommodations or potential accommodations, they're a great office to have that support. We have learning strategies, which provides tutoring and one-on-one support in terms of like, I thought this was gonna be like high school, and I now have a million things and I'm feeling very overwhelmed. And so learning strategies work with them one-on-one to really look at some of those study strategies, organizational pieces, accountability, what do those things look like, and help to build that capacity for our students. We also have great connections with our mission and ministry team to really provide students that ability to look at that spirituality piece of their life, what that looks like for them, how that's maybe morphed throughout their time. I know even for me, it continues to develop, as I quickly within the next month move into my 30s. So we really try to look at holistically, as Jenna had talked about before, those areas of well-being. How are we looking at all of those, and what resources do we have to really support students in that? So again, we are a great place for students to start. If your student calls you and says, I'm struggling, I'm sad, I'm having a hard time in class, send them our way, right? Connect them to us, remind them, you probably heard about CCP during orientation, you should reach out to them, because they will hear from us and hear about us multiple times, as well as part of Zag into Action. And so send them our way. And then one thing we like to mention is that the difference between private versus confidential. So confidential resources are people like counselors and therapists and certain members of like clergy, priests. We are private. So while we're not out, sharing every student's information to everybody, we do think strategically in how we're sharing information, who we're sharing that with. We're not out sharing students' information to everyone. We typically tell the student when we're going to connect with a campus partner, or ask them, is it okay if I give this person certain context so that we can get you connected a little bit faster, in situations where there might be a bigger concern or a level of crisis. We may need to share information with certain campus partners, but wanted to share that. And the other thing too, and this is now well over a third of our students, which we're really excited about, are self-referring. So they are either filling out a refer form about themselves, they're emailing us, they're coming in, they're calling us to make an appointment. And that is incredible. And that's increased over the years. And Jenna knows that, and as well as I see Nicola's on here as well. And that has increased over the years, which is great, and is showing that we're really working towards that self-advocacy piece. All right. So a couple misconceptions. So again, I think I said this about 1 million times, so sounding like a broken record, but we're not counselors or therapists. We can help guide students and get them connected to counseling. We have counseling here on campus. We also can get them connected to providers in the community. If they want more longer term care, we have a lot of students, we support them in doing that, as well as maybe getting connected with someone at home. So when they go home for breaks or for the summer, being able to get connected to those resources. We are not a part of student conduct. our Resolution Center for Student Conduct and Conflict. Great campus partners also down the hallway from Jen and I, and we work very closely with them, but we do not, the official term is adjudicate any cases, but we do support students through that process, because sometimes it can be challenging and be scary and be whatever it is for them, the things that they're feeling, but we try to help them and collaborate very closely with the Resolution Center to sort of debunk some of those fears and those anxieties around, what their outcomes look like from their meetings and their conversations with the Resolution Center. Meetings are not mandatory. We get no-showed, or as the kids say these days, ghosted all the time. But we do try to continue to connect with students, but they're not required to meet with us. If we reach out to a student, we often reach out to them at least 3 times, and do some other things behind the scenes to make sure we have other people, other eyes, and other sort of points of connection to make sure that student has what they need. But we don't require students to meet with us, and we can't force them to meet with us. And so we try to navigate that in different ways. So we're not just saying, oh, well, they're not going to meet with us. We try to still provide them support and try to figure out what's going on, even if they're not communicating with us. And this is one really for students, and reminder, Zag, as they enter, we cannot excuse them for classes. If something's going on in life and having a hard day, certainly there are ways to communicate with faculty of like, I'm having a rough day. I'm not going to be in class today, and there are attendance policies and there are things, and communication is key, right? It's crucial for this piece. If there's an emergency or something goes on at home, we work very closely with our academic partners to make sure that our ZAGs are being able to communicate that's being communicated with our faculty to make sure that they're excused as appropriately, but we cannot excuse students from a class. That seems like a lot of power to hold, and I do not want that power. So those are some misconceptions there. So a quick couple of last things, as I think I'm almost at time. So to refer your ZAG or to refer students to our office, many ways. You can call us. You can email us. The best way is to submit a refer form. So the link here, we have gonzaga.edu/refer. So that form that comes to us, and on that form, when you look at it, you can later today look at it and see, what am I actually filling out? That form, you can click what the primary concern is, if it's academic or if it's behavioral. And a lot of times it's both and, but what's the main, right? What's the main concern? It will then come to myself or Mackenzie over in academic advising, and we parse those out to our staff and connect students to case managers, and academic folks connect them to academic advisors, and then we often collaborate. So if it's primarily behavioral, but then we meet with the student and there's academic pieces there they bring up, we work very closely with the academic advisors to make sure that they have everything that they need, and we often meet together. So that form comes to just 2 of us, and then we assign them out to our staff. So those are super helpful. Also, we'll be back in person, which we're excited about this fall. So we're in Crosby 216. So Crosby, as Jenna said, is in the middle of campus. If you look up, there's a big bay of windows and we're up there. And if you wave, I will often wave back at you. Even if I don't know you, I'll wave. It's a great people watching spot. And we're very lucky to be up in that space. So please come visit us during orientation. We will also, I'll be presenting at orientation. We'll be around at various points, and we'd love to meet and see all of you. So again, the form is submitted, it comes to us, and then we reach out to the student through email and through phone. We often reach out about 3 times until we sort of manage behind the scenes to make sure that student has what they need. So last sort of final thoughts that I have, 2 things. One, during a case management meeting, we often meet for about 30 minutes. We're trying to figure out what the main concern is or barrier, then getting students connected to the right resources. If we're having a follow-up meeting, we talk, how did it go? Like, did you have a counseling appointment? How was it? You know, if they say, well, it wasn't that great, well, why? You know, can you explain why? And can we try to figure out other ways to get you connected, or how to communicate that with your provider over at Health and Counseling, and how to give them those tools to be able to communicate those things. And then one thing I like to say, and Jenna talked about this a little bit too, is how do I prepare to accompany my ZAG, right? Your ZAG. And there's lots of pieces, and there'll be some great information going out through new student and family programs, as well as at orientation. But some things to start talking to your ZAG about. Start talking about those things Jenna was discussing. So all areas of well-being. What does it look like when you're stressed? How do you want me to help you from afar? Right? We talk about guide from aside, right? How can I support you if you're struggling at Gonzaga and I can't come there in 10 minutes and, you know, support you? What does that look like for you? How can you communicate to me that you're connecting to the right resources? How can I support you in that? As well as little things like remembering medications before you come to campus. That's often one of like, oh, we forgot to look at a pharmacy, or where our student can go to get that, or those pieces. Also bringing comfort things from home, right? Those things that can support them. And also, if you're from California, remember that we do experience all the seasons, and a good winter jacket is important. So those are things to start thinking about as you prepare your ZAG to join us here in Spokane. So again, we have some resources. I believe these are going to be shared with you all. So there's some resources, and then here's our contact information. So thank you so much. And I'll stop sharing my screen.
A big virtual round of applause for our lovely presenters today. We're so lucky to have them with us via Zoom. There were some questions that were answered in the chat, such as the OHP positions are paid, counseling services are free of charge on a short-term model, and we do have, let's see here, psychiatrists, PDH level psychologists, and master's level counselors here at Gonzaga. I also did want to mention that OHP and CCP also regularly contribute to our parent and family newsletter. So if you are subscribed to that, you should be getting an email from us either on a weekly, biweekly, or monthly basis, and you can see those articles that we get from them as well. We have about 18 minutes left for questions. So if you guys have anything else that you would like to ask, go ahead and pop that in the chat below. I also did want to mention, if you do want to see a copy of their slides, feel free to email ohp@gonzaga.edu or ccp@gonzaga.edu, and they'd be happy to share that information with you guys. And again, we are recording this presentation, so you can watch it at a later date as well. But yeah, I'll give everybody a couple minutes to get those questions in the chat if they have any more. Yeah. While we're waiting for some questions, Jenna and Shawn, is there anything that you guys are particularly excited about when we transition back to in-person learning this fall? There, we got a question. What's the backlog like for counseling? My other child is at another university, and while they offer counseling, they have a huge shortage of providers, and it's hard to get in to see anyone.
That is a great question, and a valid one. I would say our staff here in health and counseling work, they're fabulous, and they work really hard to make sure that they are providing quality counseling and support, as well as, you know, knowing that there are a lot of our ZAGs that need that support. And so that's also why our model is a short-term model here at Gonzaga. And that's also where we sort of come into play of how can we maybe then get you connected to an off-campus provider. But we typically see, you know, 2 weeks out often, but our students get in to see our providers pretty quickly compared to some of our other sister Jesuit institutions. And so we're very lucky about that, and currently working on hiring another counselor right now. They're actually in the process of that. And so really trying to build that capacity too. But we try to figure out different ways where we can get a student connected. If it's a longer wait, we can see, can we look at something off campus, or can we, figure out other ways to manage in the meantime. I don't know if you had anything else to add there, Jenna.
No, just that I think we work really collaboratively and do the best we can to make sure that doesn't happen. I think one of the signatures, aspects of hopefully what your student will experience at Gonzaga is that we work really hard to make sure that students don't slip through the cracks. And so if they need help, they get it when they need it. And particularly on my end, we try to provide lots of opportunities for folks to interact with them throughout the campus environment so that they don't get to that point as quickly. But if they do, then we have the support available.
Perfect. I'm not seeing any new questions in the chat right now.
And I just want to Jenna's point too, and I think something that's super helpful too is that communication with your ZAG now, right? About, the goal is that, right, your experience here at Gonzaga is going to be one that is transformative and impactful, but that doesn't mean everything's going to be roses and I don't know, unicorns, those things I can think of. So how can you have a conversation with your ZAG about, if you're struggling, what is that going to look like for you? Are you going to be able to communicate with that to me? Can you just tell me I'm struggling and I can help navigate with you of like, why don't you connect with CCP? Why don't you, look at the wellness toolbox? Why don't you go down and see, chat with OHP and see of ways and different programming and pieces that are going on to provide that support. So there's that too that I think is really important to figure out. I know I didn't have that conversation with my mom when I went to college of, when I first started struggling. I remember it was probably like the second or third week and I was just bawling and I didn't know how to tell her I was struggling. And, but then having that conversation of when I was struggling, because right on your end, it may seem like they're at like a, 50, but they may really be at like a 10. They're just, expressing looks different, right, than being at home. And so just being able to have that open communication is super helpful. And we've seen it to be extremely impactful for our students and for you all too. I know that my mom still, I'm almost 30 and my mom still sits at home based on how many times she calls me a day, worries about me. So right there's that piece there about how can you have that communication that's healthy for all of you.
Looks like we have another question in the chat. Oftentimes students might not want to come forward on their own. How proactive are OHP and CCP? If another student friend comes forward and says a friend needs help, would the office contact that troubled student?
Jenny, I'll go very quickly.
Yeah, I was going to say, I'll throw it to Shawn specifically if it's coming through refer, but there's other ways that we work and coach both students through that experience.
Yeah, for us, if it's coming through a refer form, or we often have students come in and they're like, can we talk about my roommate, or can we talk about a friend? And we reach out to students as we would any other referral to our office. A lot of our students, even the students who are referring, are often concerned, please don't tell them that I, shared this information. And our philosophy is that is not, that's not what we're focusing on. We're focusing on what is the student actually experiencing. And so if a student does ask, we sort of pivot to try to really get them, the space where we can talk about what's going on. And we found that to be successful. So we reach out to them like we would any other referral. We'll call, we'll email. If it's a student that we're really concerned about, sometimes we'll work with residential life to do wellness checks for a student if we're really concerned and we haven't heard from them and people haven't seen them, and being able to connect with them in their space. So there's lots of ways we can navigate those, but we try to be proactive in a reactive setting. So as much as we can.
Perfect. Looks like we have about 10 minutes left in our time today. We have another question in the chat. Thanks for the great information. Excited for our son to attend. Shawn mentioned some questions to ask our kid since we'll be so far away in California. We'll be at orientation, but do you have any additional info about the freshman experience in the dorms and how a student who is on the introverted side might be able to integrate into college life? And
That's a really good question, Wade. I'm also from California. I'm from San Diego. So when I came up to Gonzaga, I know that was, probably a question that my parents had. And there's lots of ways for folks to get connected at Gonzaga. So I think I would really encourage, conversation about what their interests and passions are. And not necessarily you have to do 5 million things, but maybe pick one thing that you're excited about exploring. One thing that you'd feel comfortable engaging in right away. And if you don't feel comfortable, then what are your kind of backup options? So I think having the conversation is another step. And I don't know, Anna, if you've highlighted the parent and family essentials sort of guide that you provide for families, but I think that's a really fabulous resource for families to consider. And you can learn a little bit more about all these different areas at Gonzaga. So you could learn a little bit more about specifically the residential experience, what might be expected from their particular living environment. I know students are able to get connected to their roommates, and start having that conversation. So that might be a helpful tool, again, to start to build that connection. But what's also nice about the parent family essentials is that we have all these talking points, guides. So really thinking about, your student best. Hopefully they know themselves best, but you're also a key player in that, right? So I love that you're thinking proactively about, okay, this is what might be challenging for my students. So really, hopefully this will be a tool to talk about some of those maybe more sensitive or tricky topics that it's great that you can be proactive prior to getting here, and then have an ongoing conversation. So again, because you shared something, about that student's experience, you could do that check-in, right? You said you might get interested in this. How did that go? Like little bit of question, guide from the side kind of strategy that could be helpful.
I'm going to jump in a little bit on that parent and family essentials. We are currently working on getting our updated version of that ready for you guys to have at orientation, but I'm going to go ahead and put last year's copy, a link to that in the chat real quick. So you guys will be able to access that as well. And like Jenna said, there's some really great resources in there to help you guide your student through that first year here at Gonzaga. Some really great resources in there as well. Any more questions, go ahead and pop those in the chat. We have about 8 minutes left, but if we find that our questions sort of dwindle down, we will end a little bit early. And another reminder, we are recording, so if you joined a little late, you can watch a recording of this video on our YouTube channel, Gonzaga New Student I can't speak today. Gonzaga, New Student and Family Programs. Looks like we have another question. My son, who may not be the most social, chose Chardin as a dorm. This has doors that go directly outside, so I feel like he may have less contact with others in the dorm. Any thoughts?
You want to take that one first, Shawn?
Sure. Yes. And I don't know if Nicola wants to jump in at some point. It has some good pointers there too. But I think what's important, all of our res halls, right, there are different challenges and there are different, exciting points about all of our res halls. And it's important to remember that, especially now as we're returning to campus and we're trying to figure out what this new environment looks like, that folks are behind the scenes working really hard to think about how can we really engage our students, especially those maybe in different residential communities that are maybe not the traditional, right, hall or floor. And we really our RAs are a big part of that. So our students that live in those spaces, and really trying to engage our ZAGs and understanding sort of what's going on, and maybe encouraging them to come to them if they're struggling with finding community. And there's so many ways. I think one of the amazing parts of Gonzaga, there's so many ways to find community here. And while yes, it's great to have that community in your living space, we can also find it in so many other spaces as well. And then sometimes just being a little more creative in some of those spaces that are a little more challenging in terms of what we traditionally think of as a community. And we've seen those spaces build that sense of community amongst each other, and it just looks different for folks.
Yeah. And I think what I would add to that is just that we're all very eager to support your students in the return to in-person community building. We know so much of that experience has been lost during the pandemic. So really working with our campus partners, like the folks in Residence Life, where all of our offices, Shawn, are involved with training those staff. So we have conversations with them about how do you set up, you know, environments that are supportive of health and well-being. What's this going to look like? How do you establish rapport with your residents so that they can come to you? You know, they can integrate within their halls in ways that honor and support the various comfort levels that students might have. So whether that's because I'm introverted or extroverted, or whether it's because I'm unvaccinated, or, you know, various things that might be going on, but those dynamics that allow folks to feel the part of the community in ways that they feel comfortable doing so.
We have about 4 minutes left. I'm going to go ahead and do a last call for questions if you have any, and then we'll go ahead and wrap up after that. But speaking from my own experience as well, I would say that clubs and that's a really good way to form community as well. I'm a rising senior right now, and I got involved in the Gonzaga Environmental Organization my freshman year, and some of those people in that club are my best friends right now. So encourage them to get involved, even if it's just one thing, like Jenna and Shawn said. Just find something that they're interested in. And we have a comment in here from Nicola Minetter, our Director of New Student and Family Programs. I'll go ahead and read that. I think it's also important to remember that friends are not only made in their residence halls. Students actually spend most of their time in classrooms, in common areas, and in our student centers and study spaces, together where they'll meet and connect with folks from all over campus, not to mention the plethora of social activities that will be planned for students during their first weekend on campus and beyond.
Good point, Nicola. We also try to emphasize that not everything has to happen in their room, in their residence hall, right? Often when students have challenges, you know, sleeping, it's because they're doing literally everything on their bed and their body doesn't get the message that, oh, this is the place I'm supposed to be sleeping. So definitely getting them out and interacting with others and experiencing the environment and how they can support them. It's a good strategy.
Yeah, I was just going to say retweet, Nicola. Thank you. Agreed. And retweet, Jenna.
Okie dokie. Well, if there are no more questions, I'm going to go ahead and bring this session today to a close. Our next ZagTalk 101 will be 2 weeks from today, and it will be on student engagement. Oh, we did get a quick DM. Is there a list of clubs, student organizations which my daughter can pursue? That will be touched on our student engagement webinar in 2 weeks. We'll be there with our Center for Community Engagement, our Diversity, Inclusion, Community, and Equity, DICE, and then our center, our Student Involvement and Leadership, SIL. So yeah, that will be happening 2 weeks from now. Once again, a thank you to Jenna and Shawn for being here with us today. And with that, I am going to say goodbye and go Zags.